Good Day Atlanta, live from the Fox 5 studios.
She was the first African-American to grace the cover of American Vogue and went on to an incredibly successful career as a supermodel. And in addition to breaking down beauty barriers, she's telling women about an important health issue. This morning, we're catching up with the lovely Beverly Johnson and Dr. John Lipman. Good morning to you both.
Good morning.
Thank you so much for stopping by. Beverly, what an honor to meet you.
Oh, thank you. I'm very happy to be here this morning.
Gorgeous as ever, and we want to talk a little bit more about your career and what you've been up to. But first, let's discuss this important health issue that you're raising awareness about, uterine fibroids. How did you find out that you had them?
I was first diagnosed in my 30s, and I like to say I'm very happy to be the national spokesperson for the campaign Ask For, Tell For, which is to empower women about uterine fibroids and their options, their medical options. And I had uterine fibroids in my 30s. They became symptomatic in my 40s, and I had a hysterectomy, which was very complicated. And we know now, or I know now, I had other options. And I'm just out there to empower women to, you know, go on the website and check out your options, because it's very prevalent in African-American women.
3 out of 4 African-American women are diagnosed with uterine fibroids, and it's a common problem among all women as well, doctor.
Indeed. 1 of every 3 women have fibroids, typically seen in women between the ages of 30 and 55.
And what are the symptoms? How would you even know that you might have them?
The most common symptoms are heavy bleeding, pelvic pain, and increased urinary frequency.
Okay, but a hysterectomy, it seems like a pretty drastic way of addressing this issue, and you don't have to go that far, do you?
No, you don't. It is certainly an option, but there are a number of options, and women can avoid surgery altogether. The particular procedure I perform is called uterine fibroid embolization, or UFE. It's completely non-surgical, done as an outpatient. Patients leave the same day with a Band-Aid.
Wow.
So there's no surgery, no general anesthesia. The recovery is about 4 or 5 days, and they go back to work in a week. So it's completely non-surgical and treats all of the symptoms from fibroids. Okay,
we're talking more about this Ask For, Tell For campaign. What are the 4 questions you should be asking yourself and your physician?
Well, the most important question is, do I have fibroids, and what are uterine fibroids? And then talk to your physician about these symptoms, the heavy bleeding, the pelvic pain. Do I have those symptoms? Because if you don't have symptoms, there's no treatment necessary. So it's important to know if you have fibroids, and if you have these symptoms, talk to your doctor and know your options. It's not just hysterectomy.
Right.
Okay. And then tell 4 people, or you can tell more, because my experience has been that everywhere I go, you know, when I bring up the conversation, they know someone, their mother had fibroids, their cousin, their, you know, their sister, and you know, there's this conversation that, you know, goes on that we need to have now, and that we need to,
because there's so many misconceptions out there.
Yes, and I mean, basically for me, I've suffered in silence for about 4 years, and I mean, really 1 year I really wasn't able to go out of the home because of those symptoms.
They were that debilitating.
Yes, it is.
There are over 1 million women in this country currently that are these silent sufferers like Beverly. They don't want hysterectomy, so they suffer in silence, bleeding very heavily, and it's a very miserable existence. They're not living.
Your personal relationships are down the hill. And then I must say, even after the hysterectomy, there's a whole nother set of complications, because this for me, it was an onset of menopause. So when I thought I was getting rid of one problem, I dove into this whole other situation. And it's a situation I don't want my daughter to go through.
Sure.
And being African American, she, you know, 9 times out of 10 she probably will get fibroids, but she will know, and she will be informed, and she'll be able to go in and speak intelligently with her doctor.
Absolutely. Well, you look very well, I have to tell you. Beautiful as always. Tell me what you've been working on and where we can see you next.
You can see me on a television show called She's Got the Look. We're in our 2nd season. We chose the next supermodel over 35. It's a lot of fun. And so you can see me on that show, and of course you can always go out and buy my wigs and hair extension, which are out there doing very well.
Well, congratulations.
And you
on
can
all the
also
success.
see me on this platform, Ask For, Tell For. This is a passion of mine, and I'm very happy to be able to bring this message on a national level.
Well, we're happy you're sharing this message with our viewers this morning. It was great catching up with you, Doctor. Thank you for your insight as well.
Thank you.
Asking a few simple questions can make all the difference in your health. For more information, log on to myfoxatlanta.com. The Good Day guest info is listed under the scene on TV.